My name is Mark Alivero, and I've always been someone who enjoys staying active and making the most out of life. Before my surgery, I struggled with debilitating lower back pain caused by spondylolisthesis and lumbar spinal stenosis. The symptoms were relentless, constant pain, difficulty standing or walking for long periods, and a significant decline in my quality of life. After exhausting every non-surgical treatment option, including physical therapy, injections, and pain management techniques, I knew I needed a lasting solution. That's when I turned to Dr. Sanjay Ghosh.
I was first introduced to the concept of the MiTLif and minimally invasive spinal surgery technology about 25 years ago when I was in residency at the University of Southern California. And I was immediately drawn to the minimally invasive technology because I was always concerned about the open surgical techniques limitations, particularly if a person was athletic and wished to get back to athletic pursuits such as skiing, tennis, and golf. I have found that the minimally invasive technique is a dramatic improvement on the traditional surgical technique in that it allows the surgeon to save and preserve those key back muscles, and it really allows my patients to get back to life as they knew it or life as they wish to live it. MiTLif can treat a variety of spine conditions such as spondylolisthesis, spinal stenosis, herniated discs, and sciatica. If you're experiencing nerve compression or chronic pain that hasn't responded to physical therapy, medications, or injections, MiTLif could be an excellent option for you. With the minimally invasive technique, you have to recreate a 3D image of the patient's spine based on their CT and MRI in your mind. You then have to use real-time X-ray and the small anatomic clues and cues that you get at the time of surgery to orient yourself and then work through narrow corridors using the operating microscope. I am fortunate that I've done this surgery over 800 times and I'm very comfortable doing the surgery, but it is more challenging than the open technique, and that has limited its adoption by many surgeons.
From the very beginning, Dr. Ghosh and his entire team made me feel comfortable and well-informed. The preoperative process was seamless. His staff answered all my questions, scheduled all the necessary tests, and ensured I was fully prepared for surgery. One of the most valuable aspects of their care was how they interfaced with my insurance carrier and handled all the pre-authorization paperwork. I never had to worry about dealing with the complexities of the insurance approvals. They took care of everything for me. On the day of the procedure, I felt confident knowing I was in skilled hands. Dr. Ghosh met with me in the morning to provide a final overview of the procedure, addressing any last-minute questions and ensuring I felt prepared and at ease. His team of nurses, anesthesiologists, and assistants was equally professional and compassionate with me, making the experience as stress-free as possible.
A single-level MiTLif is a minimally invasive procedure that typically takes around 2 to 3 hours. Because of the small incisions, most patients can go home the same day or after just one night in the hospital. In contrast, traditional surgeries can take longer, and patients often need to stay in the hospital for several days. Most patients are up and walking within hours of the surgery. Within 2 to 4 weeks, you can begin light activities such as walking and gentle stretching. By 6 weeks, you can start increasing your activity level, and within 3 to 6 months, you should be able to return to more strenuous activities like running or weightlifting. The key difference with MiTLif is that because we preserve the muscles, patients typically recover much faster and with less discomfort. Of course, as with any spine surgery, there's always a slight chance that additional treatment may be needed in the future, but the risk is relatively low. The procedure is designed to stabilize the spine for the long term, and most patients experience lasting relief.
Thanks to Dr. Sanjay Ghosh, I now have my life back. The excruciating pain that once dictated my daily routine is completely gone. I can now walk, stand, and move freely without discomfort. This surgery just wasn't about relieving pain. It was about regaining my independence, my confidence, and a quality of life. I'm beyond grateful to Dr. Ghosh for his skill, professionalism, and dedication to his patients. If you're struggling with severe lower back pain and considering spinal fusion surgery, I wholeheartedly recommend Dr. Sanjay Ghosh. His expertise, compassion, and commitment to patient care are unmatched. Choosing him as my surgeon was the best decision I could have made, and I can confidently say that my future is brighter because of it.